Hi, I'm Dr. Rasya Dixit from Bangalore. Today we'll be talking about skin pigmentation. This is one of the primary reasons why most people seek out a dermatologist's help. One of the common causes of skin pigmentation is that, as we all know, Indians are mostly having brown colored skin, and any kind of injury like a small acne breakout usually lends to pigmentation. The second and the most common cause again we see is something called melasma, which is a hormonal pigmentation which runs often in families, made worse by sun exposure. And one of the third common causes of pigmentation could be the injudicious uses of creams which are supposed to help for pigmentation, which are usually available over the counter. Let me talk to you about how these three things can be tackled. If you do have acne, make sure you do not pick at it, because picking at it just makes it leave more marks or more pigmentation than usual. Make sure you speak to your dermatologist and use a gel-based sunscreen which can prevent pigmentation developing on these acne marks. The second thing is to use a skin lightening cream which is safe and contains mostly glycolic acid or kojic acid, which will help to lighten out these marks effectively. The second cause that I mentioned which can cause pigmentation is melasma. Now, unfortunately, melasma is inherited, so if your family suffers from melasma, you might too. But you can keep it at bay by using a broad spectrum sunscreen regularly and at frequent intervals so that the sun does not damage your skin further. Using skin lightening creams containing retinol, glycolic acid, azelaic acid also help to lighten out the skin. Remember, treatments such as bleaching the skin may actually end up harming your skin and making the pigmentation worse, so avoid all these treatments. And the third reason that I mentioned was use of over-the-counter fairness creams. Some of them contain sensitizing agents or steroids which actually make your pigmentation much worse. So if you're picking up a cream, make sure you discuss it with your dermatologist who can advise you whether this will give you a benefit or can advise you a medical cream which might be more suited for your skin type. Finally, remember, whatever you're doing, make sure your sunscreen is on every day, even on a cloudy day, because UV radiation is different from sun or visibility of the sunlight. So you might be thinking that it's actually a cloudy day and you don't need sunscreen, but you need sunscreen to keep your skin from going dark even when you're on good skin lightening products. That is your safety barrier. Thank you for watching. Please do subscribe to Skin Diaries to get more videos and updates, and leave a comment below if you found this useful.